Our feet carry us through a lifetime, but for older adults, a little foot pain can mean a loss of freedom. Stick around to find out why healthy feet are the foundation for independent living. Hi, Dr. Lakelyn here. I'm a gerontologist and caregiving advocate for Home Instead, an honor company. I'm so glad you're taking time to listen. Be sure to subscribe to Caregiver Chats on Apple, Spotify, or your favorite podcasting app. I also love your questions. You can email me at caregiverchats@homeinsteadinc.com. Today, we're diving into a topic that often gets overlooked: foot care for older adults. It may not always be top of mind, but healthy feet are truly the foundation for independence and quality of life. When our feet hurt, walking becomes harder, balance can suffer, and everyday activities can become more difficult. For those who may be more familiar with the term podiatry, this is an area of medicine that focuses on foot and ankle health. Podiatrists and foot care specialists help prevent and treat issues like infections, ulcers, nail problems, and pain. Things that can have a big impact on an older adult's ability to stay active and independent. I am thrilled to be joined by Sheila Buehler, a nurse practitioner from Rochester, Minnesota. With over 30 years in the medical field, Sheila has dedicated herself to helping people live comfortably and confidently by prioritizing foot health. She is the founder of Foot Care Professionals, where she provides safe, accessible care with a personal touch. Today, we'll talk about what caregivers should watch for when it's time to see a podiatrist and how you can safely support foot care at home. Whether you're new to this or already helping a loved one trim their nails and choose their shoes, you'll come away with practical tips and a renewed confidence. So let's get into it. Welcome, Sheila. It's so wonderful to have you with me today.
My pleasure. Thanks for having me, Lakelyn.
Oh, the pleasure is truly mine. I thought that we could start by having you share a little bit with us about your background and what drew you into foot care in your career.
Pure serendipity, Lakelyn. So I'm an old soul nurse. I'm actually third generation nurse with background for 30 years now in organ transplant and cancer work. And then in 2017, I decided to go to procedure work, and that's how I ended up in podiatry at the clinic here in Rochester, Minnesota, which can remain unnamed, but we all know what it is. And changed my life, literally changed my life. I had no idea you make it through all these things in life, and then at the end, you can't even get to your feet. The toenails get thick and curly, our backs, our hips, our knees, thick toenails, calluses, our hand dexterity, dementia. This is a thing for everybody, just like dental care and eye care. And unfortunately, there's some real barriers for insurance coverage because it is viewed as a routine service unless you're high risk with nerve or circulation damage. So I actually resigned from a job I absolutely loved in 2021 to create an open access foot care clinic where you didn't need to meet Medicare criteria. You didn't need any certain insurance coverage. It's just open access. When you need help, we're here to help.
Well, Sheila, thank you so much for sharing your career path, and you bring all of that wisdom and knowledge to your foot care clinic. And I think it's so wonderful that you're addressing such a need in your community for older adults. And you're right, you listed a lot of reasons why foot care becomes more challenging as we age. And I would also be curious to kind of kick off our conversation. I know foot care is maybe not the most sexy topic, but you know what? We all have
glamorous.
feet.
Yeah, it's not glamorous.
We all have feet, and we need them to help us get from A to B. And so I think it's important that we're discussing foot care on this podcast because so many caregivers, family caregivers, are supporting their loved ones, and they might not realize some of the challenges that their loved one is facing might be due to issues with their feet. So what are some of the most common foot issues that you see older adults faced with?
Lakelyn, you are exactly right. It is. I thought colon cancer was personal. Foot care is personal. People are very close about their toenails and the fact that they can't get to them, or that 70% of us over age 60 get some degree of toenail fungus. Like, it's really a cosmetic thing that starts to affect ambulation when it hurts. And so when the caregiver role, just watching that gait to see, are they favoring one side? Because I've seen where a callus, right at the base of the pinky, you start to walk more towards the inner part of the foot, and now you've made a balance problem even worse. There's been falls. I've seen broken ribs. I've seen broken hips over calluses that weren't paired. So for caregivers, it's do not ignore a painful callus. That would probably be the number one takeaway. And then the number two thing is, when things get too thick or too curly, or you can't file it down a little bit, then it's time to get help. And there's literally the only two things that the feet have to have are cream to the feet at night and a wide toe box shoe. That's literally it.
Wow. Those are two easy tips right off the bat.
Yeah. Pearls.
Well, and I think that it's so interesting that you talk about, the gait and watching. And for those that might not know that term, that's really just how we walk, is our gait. So noticing when a person is favoring, maybe our loved one is favoring one foot or the other, or like you said, kind of touching one side of the foot down first. Those little changes in their gait can go a long way in impacting their ability to move safely in their environment. And we know people want to stay in their environment as long as possible. Falls are a fear of many older adults. So having this knowledge as a caregiver of checking your loved one's feet, while some might feel it's a bit of a private thing, it's a good practice to get into, because as you're explaining, our overall mobility, our independence, our health is really closely tied. So what would be maybe some of the risks, Sheila, of ignoring these foot problems? I know you've mentioned a few already, but are there any others that we need to be aware of? Any other risks?
These are the types of thing, Lakelyn, that make sense when someone says it, but until someone says it, you can just see the light bulbs go off when I get talks like, oh, that's why that happens. So for example, I always say pressure is the enemy of the foot, and it can be external pressure from shoes too tight. People with peripheral neuropathy cannot feel when the shoe is too small, and usually will often run 1 to 2 sizes too small, which doesn't help. So then they get those red spots. So watching for the red spots. When you take the shoes and socks off, that's when you can pick up any problems early. Left untreated, it will only get worse. So believe it or not, dry skin is a big thing in the foot care world. The name for that is xerosis, Xerosis. Dry skin equals worse shear force and pressure points. And when there's internal pressure from edema pushing out on the skin, pushing on the muscles, pushing on the vessels and the nerves, the skin can get little micro cracks, and then staph can get in there and cause cellulitis. So dry skin can lead to that. Dry skin can lead to shear force if they're shuffling or they got tight hammer toes rubbing together. So then you can get actually corns or calluses or ulcers, full-blown ulcers in between the toes, never mind on the tops and bottoms of the toes as the toes go from straight now to more of an angle. Instead of walking on the pads of the toe, every hammer toe has 3 potential pressure points. One on the tip where there's less padding, one on top as this gets driven right into the roof of the shoe. And then if this bone is up, then the end of that bone is down, that metatarsal head, pushing right into the toe, into the ground. So having shoes that are supportive and also protective. Knowing how to purchase shoes, which we can talk about that. So keeping the skin hydrated so you don't get cellulitis, pressure points. Just putting cream on the feet at bedtime will cut a vascular patient's risk of ulcer by 50%. We consider cream medication to the feet. Shoes, one of the most common questions, and given your audience, I'll share with you something I learned at our last foot care. I'm part of the American Foot Care Nurses Association, and we have an annual conference with a nationwide network. And there is an entire company dedicated to foot care for edema. So I'm actually going to feature this because I wish I'd known this about 7.5 years ago. PEDORS. If you, as a caregiver, are struggling with that edematous foot and you cannot find a shoe, and your loved one doesn't walk a lot, they don't need a running shoe, they don't need a solid New Balance or a SAS shoe. These shoes come in a variety of options that I wish I'd known a long time ago. So highly loving that trick.
Can you just explain edema really quick for those that might not understand that term?
A swollen foot is not a happy foot. Yeah. So it gets back to that notion of pressure being the enemy of the foot. So pressure externally is shoes too tight, or it can be internal pressure where the fluids just are not processed. It pulls down. Gravity brings those fluids down. Our hearts aren't as efficient. Our kidneys aren't as efficient. Neither are our blood vessels or the lymph system. So it's harder for our bodies to push that fluid back up into our central circulation. So this is where things like compression hose, wearing or raising the feet up, at least 20, 30 minutes, 2-3 times a day, just to let gravity work in our favor so it's not pooling. And then avoiding tight shoes that are going to put even more pressure on a foot that's already swollen. So that's where when I see an edematous foot, my first concern is that skin dry? We need to keep it hydrated with a cream. Lotion is more watery. A cream is also water-based, but it's thicker.
Well, I'm glad that you made that differentiation, because in my mind, I kind of had lotion and cream in the same category. So I'm glad that you helped to explain that better. And we'll link to that shoe option that you mentioned in the show notes so that people can access that. Any of the things we talk about today, we'll link to in the show notes, because this is all so helpful. So instead of just a lotion, you want to go for the cream, keep that foot hydrated. If swelling is an issue, look at the shoes. Elevate the feet regularly throughout the day. These are all such helpful tips. And so these sound like things that caregivers could really just implement in their kind of daily routine with their loved one. Any other kind of daily routine care tips for the feet that you think are important to mention?
So the feet so when people come in for foot care, of course, I'm going to take care of their toenails. Of course, I'm going to take care of the calluses. What I'm really interested in is their circulation, their nerve, and their skin. We look at shoes and we look at inserts. When do you need inserts? If the feet hurt, please don't ignore that, because that's going to affect their mobility. One of the biggest issues that affects people is arthritis of the feet, and that is a difficult thing. I haven't found a great solution for that other than keep the shoes, wide enough, long enough, tall enough. And then if there's structural things like a bunion or a hammer toe, believe it or not, there's different lacing techniques, and you can even Google this. But there's two of my favorites are lock lacing, where it basically puts a seatbelt around the ankle so that the foot doesn't slide forward into the end of the shoe, which keeps pressure off the hammer toes. Also, a mesh top shoe will allow for the bony changes with arthritis. And then the other thing is you can actually get your shoe stretched. If you look, I always say when you're buying shoes, if you look down and you can see your bones sticking out, that's too tight. You want to accommodate that, whether it's with shoe stretching professionally, not just one of those things you put in over your overnight in your shoe. And then a mesh top, making sure that there's no seams or stitching over those bones, because that can hurt and restrict, especially a bunion. And making sure, the other thing is socks. I'm always learning more. This sock thing, you can get thicker socks, thin socks. If you have edema, you're wearing compression hose, plus or minus regular socks. Just make sure that shoe is big enough to accommodate. Even like for females, you'd be surprised how many women are in a men's shoe as we get older, because starting in our 40s, the ligaments change. The ligaments that hold these 25% of the bones of our body are in our feet, and the ligaments that hold them together get lax over time. And so the foot actually becomes longer and wider, And it doesn't come down straight necessarily. It can come down this way or this way. We've all seen people with kind of valgus feet. And man, as long as they don't hurt, just keep your shoes and cream to your skin is great. But when they start hurting, that's when you got to listen, because it's not going to go away on its own. And then we start looking at inserts as a shock absorber, and also to offload any calluses that are occurring.
Gosh, there's so much more to foot care than I ever could have imagined.
Oh, there was one other thing I was talking about. So we talked about the lymph and the edema. I always forget to talk about the vascular. Your calf muscle is actually a calf pump. Everyone knows they need to walk, but what they don't realize is that calf muscle is sometimes referred to as a second heart. That is what's going to pump blood and lymph from your feet back up. So the more you can move those feet and that calf muscle, the better. Keep going with it. Sorry, Lakelyn, I wanted to make sure I got that in.
That's so helpful, because that could be something great for caregivers to kind of build into that daily routine with their loved ones, making sure they're getting up, walking around, or even just moving their feet and getting those. I like that second heart, your calves pumping. Yeah. I've never heard that before. Sheila, earlier you mentioned that you were going to cover some tips on shopping for shoes. So could you give us kind of the rundown on what people should be looking for when they shop for shoes?
Absolutely. Thank you for asking. So a lot of things to think about. So basically what your feet need is a shoe that's wide enough, long enough, and tall enough for the foot you have now. Not the foot you had when you were 20, 30, or even 5 years ago, because the bones are always shifting and the bony the structures is always changing. The hammer toes become more hammery and the bunions start leaning even more. So shoes have two purposes. They can be protective, but they also can be supportive. So a protective shoe is great for like in the house, but a supportive shoe is needed when there's a pain issue or a neuropathy issue. So if you can take a shoe and fold it in half or twist it, that is not a supportive shoe. That is a glorified slipper. And it will protect you from getting a nail in your foot, but it's not going to support your bones. Your heel complex, which of course is connected to your knee, which is connected to your hip. So when you're buying shoes, it goes from a cosmetic decision to look cute to a medical decision. We actually view shoes as a medical device. Matter of fact, the Medicare covers diabetic shoe. There's literally a diabetic shoe program for this reason. And so you want the shoe that's wide enough, long enough, tall enough. If you suffer foot deformities, so that can be hammer toes, that can be bunions, that can be a bone that sticks out the side of your foot, be mindful of a mesh top shoe, something like a Brooks or a Hoka, something that's not going to have a seam right over the tops of the bones. And then when you put that shoe on, look down. Are your bones sticking out, or is everything happy? If your bones are sticking out, then that shoe either isn't wide enough or you need to look at a different material. Also, if it's a leather type shoe, that can be stretched professionally at a shoe repair place. There are people called podorthists who can help guide you to find the right shoe. It's hard to know. Your doctor or whoever fills the diabetic shoes prescriptions would know how to find shoes if you're struggling. When I think shoes, you think size and width and height. I also think about lacing the shoe. So when the foot is in the shoe, some people have a bone on top of their foot. It's called a cuneiform bone that kind of sticks up and can get irritated. There's a thing called gap lacing where you can do crisscross, crisscross, straight, crisscross to make room for that bone. So that helps a lot of dorsal foot pain on the top of the foot. You can also gap lace the front of the shoe where you just go straight, and then start crisscross, and that'll give just a little bit more room for those bunions, and that can help ease some pain from bunions. The other lacing would be lock lacing, where I'm going to have you Google that because I can't explain it without demonstrating it, but it basically puts a seatbelt on the ankle. And that works so that the foot doesn't slide forward and cause pressure on the forefoot. So we talked about shoes, we talked about lacing, and then it's inserts. Do you need inserts? You don't need inserts if your feet don't hurt. Matter of fact, use your muscles, use them as much as you can. But when they start hurting, or if you see red spots, pressure here, pressure on top, pressure on the bunion, any red spots need to be accommodated because it's not getting better. That's where we like mesh. That's where we like things like Band-Aids or silicone tape to just kind of be extra skin. What else can we do to help with that pressure? Oh gosh, those Pedifex devices. It's lamb's wool if it's between the toes, look for lamb's wool or something that's gonna protect and separate without adding bulk is the key. And then socks, you need a shoe that's going to accommodate whatever socks are needed as well. Those are all my pearls.
Well, those are a lot of pearls.
Yeah.
So much great advice on the types of shoes to think about. It's not just as simple as going out and picking one that looks cute. You really have to think through, is it going to be functional and help me, ambulate around my environment, get around, support my feet, and maybe take away some of the pain that I'm experiencing.
Yeah. You'd be surprised. It can help a lot. Yeah.
So we've talked a little bit about maybe some of the kind of behavioral indicators that something is kind of off, like watching for the gait, or maybe like I would imagine grimacing would be indications of pain when walking. Anything else in that kind of category that caregivers should be looking out for?
When you take the shoes and socks off, that's the time to look at the feet, because that's when you're going to see, this is a little red on top of that second toe where that hammer toe is, or that bunion isn't just a sort of a quiet, darker red. It's actually a bright, angry red. Then you need to make some changes. We don't worry about chronic changes. We just keep it hydrated and give it enough room. But if you see something bright and angry red, or painful, like when you're bathing, and then foot inspection, especially if they're diabetic or have any vascular disease, looking in between the toes, because you can get pathology, top, bottom, sides of each toe. It's almost like going to the dentist, only it's for your feet. You look top, bottom, sides, always looking for pressure points.
Very, very important to consider. And I think it's so interesting how our whole body's connected. So when we talk about chronic conditions like diabetes or vascular conditions, your feet might not be something that you consider or think about, but it is part of our whole body and it's all connected. So taking care of the feet is so important. And if caregivers are noticing these changes or these issues, Sheila, how often should they be getting to a foot care specialist? And what is the benefit of seeing a foot care specialist? Yeah. Because, I go and get a regular pedicure, but I know that there's a very big difference between, somebody that does that for a profession and someone like you who works in this field day in and day out.
That's a great question, Lakelyn. And really with foot care from a medical standpoint, the early bird gets the worm. It prevents so many problems. That's what shocked me the most when I went into this field, was how people can do so much to help themselves if they just knew what to do. And so that is literally my crusade, is just to keep teaching and training, and none of this is expensive. This is all very doable if you just knew what to do. So thank you for having this podcast. We've talked a lot about, just mobility and that kind of thing. It's just getting it early, and then when something develops, you can talk to the primary or an endocrinologist if you're diabetic. You can see a podiatrist. You can, if it's a shoe or insert question, there is a person called a podorthist Pedorthist. And there's not enough of them in this country, but they literally study the biomechanics and the kinetic chain of how the foot is connected to the ankle, connected to the knee, connected to the hip. I had someone where their neck pain got better when she got the right insert. So it is, we call this the kinetic chain. It goes all the way up, and your feet are the interface of your body with the earth. And so if that's off because of age-related changes or neuropathy, sensory changes, you have over, is it 200,000 sensory nerve endings on the bottoms of your feet? It's just this huge number that's talking to your brain. And if you lose that position sense, you can't tell if your foot's on the gas pedal or the brake. So this is just some examples of what can happen. And then the caregivers can see, if they're kind of weird where they're putting their foot, they might not be able to navigate. So then it's time to have gait aids and take your time. We usually fall when we're in a hurry or tired, those nighttime bathroom breaks, and then having shoes for around the house that they're easy in, easy off without being a fall risk. And that is there's a lot of trial and error there, because you got to be able to get in it before you got to get to the bathroom. Otherwise, the toes become furniture finders, which isn't fun, especially if you're on a blood thinner. Yeah. So these are all, stories. And then just knowing that when those things happen, there's a lot of products available to us now that we didn't have even 15, 20 years ago. This is one of my favorites. It's called silicone tape. And when you get those red spots on your bunion or your hammer toe, this just acts like extra skin. You just put it, try to get in the camera, you just put it right over, and then it diffuses the pressure so it's not so mad. It protects the skin. There's little foams that you can put in between the toes. There's covers, but the name of the game is to pad and protect without adding bulk. You don't want to put a big bulky pad in your shoe. Yeah. I've seen feminine products in shoes, of course, cotton and gauze. We prefer wool if you can, or products specifically designed. This hammer toe crutch, this is a great thing when you need to lift that toe. If you've still got flexibility to the hammer toe, that'll make it so you're not walking on that tip anymore. If you can get that up, now you won't get an ulcer on the tip of your toe, long as it fits okay. If it's too tight, pressure's the enemy. So there's a lot of things you can try. It's helpful to have guidance, and that's where a podiatrist or someone who is trained in foot care is helpful. You can go to the website afcna.org, the American Foot Care Nurses Association. We have a nationwide network of providers and we're all nurses, we're all just born teachers. So there's so much we can do. One of the companies that all podiatry people use a lot is Pedifix, Pedifix. So for caregivers looking for something, my loved one has a callus down here. Well, they make pads. They make all dancer pads, U-pads that'll offload that. Still need a good shoe, still need an insert, but just to get that comfort until they get that callus taken off is a wonderful thing.
Gosh, there's so many resources, and we'll again link to these all in the show notes because they're so helpful. And these are little things, as you mentioned, kind of at the start. A lot of this foot care isn't overly expensive. It's just little changes that you can make that can make really a huge difference in the well-being and the mobility of the individual, and ultimately probably their independence too. Because if you can still move around, you can still do a lot of things for yourself. I'm thinking if caregivers are listening, they might be asking questions about trimming their loved one's nails, because that is something that I think a lot of caregivers, trimming, filing, something they probably feel like is one of their tasks that they keep up with. So any, tips for that that kind of foot care or any other foot hygiene? I know you, again, the cream, the lotion is a big piece of it, but what about the trimming of the nails and the filing?
That is a great question, Lakelyn. I didn't even have that on my radar. Yes, trimming and filing. Filing you can't go wrong with. You can file no matter how thick or curly the toenail is. And when you file, you want to file from, in this direction, kind of down and out. Filing, you almost have to do it every week or two to keep up with a really thick toenail. If it's a pincher toenail, so when we're cute and 20 and everything's perfect and our nails are flat, that's no problem. But over time, mostly from genetics, but also affected by shoes, body weight, and activity, the toenails can get curlier, especially on the lesser toenails, even on the big toenails, the ingrown. So you can have surgery for ingrown toenails. There's also, for people who are prone to ingrown toenails, there is a product called Onyfix, Onyfix, that is done by trained professionals. And what it does is it puts a band here so that it takes that curly nail, and as the nail grows, it brings the sides up. And so now you have the nail floating on top of the skin, and they didn't have to have surgery, which is really, really helpful for our senior population. But management of the toenail, so file down this way. If you're clipping, you want to do just 1 to 2 millimeter bites if it's more of a curly nail rather than a flat nail. And then at home, we would caution not to take it back too far. The curlier the nail, it's kind of a balance between the nail and the skin. I always say ingrown toenail is the relationship between the nail and the skin. So if you trim that nail too far, then the skin will roll in. So it's best just to kind of keep the ends off, to file it so it's not catching on socks, especially compression hose. We'll usually bevel it just to kind of smooth it, and then doing it more frequently rather than, one big, long, back too far deal. Medically, we will do a medical trim. We will take it back further, and we will shape it and sculpt it and, make it all happy. So then you'll get a good 2 months, 2 to 2.5 months usually.
Wow.
But it's less is more, and just little bits. And then to soften the nail, feel free to use like a skin cleanser. We don't do foot soaks in the clinic. We use a skin cleanser and let that soak in for a minute or two. The skin just soaks it right up, and it also helps decrease any, like if there's a nick, it just minimizes any risk for infection. I don't think I've had an infection in 7.5 years. And then if you nick the skin, you want to treat that right away with Vaseline and a Band-Aid. Typically, we reserve the bacitracin ointment for if there's an infection present. And they are not, the current guidelines don't support Neosporin, even though we all grew up on Neosporin. So wait 5 years, the guidelines will change.
Well, I have a little one at home, and I've learned Vaseline is like the miracle cream of all creams. So that's always a safe one to go to.
Speaking of, let's talk about heels.
Yes.
A lot of folks will get a really thick, dry heel.
Yeah, I'm guilty of that.
Lots of folks, all ages, doesn't matter. Here in the Midwest, from September through May, the summer humidity comes down. The furnaces start coming on in about October, November, and by November I'm seeing heel fissures and heel cracks. So just filing that, so callus starts to regrow in just 2 weeks. So again, it isn't one big long filing session. It's about every 2, 3, 4 weeks, just very, very carefully. And then for heels, you can use Vaseline, or better, you can use a urea, UREA based cream. You can buy straight urea, but I tend to like it when it's mixed with cream better. There's all kinds of creams out there. Gold Bond Softening is one with moisturizers and urea in it. So that's one of my go-tos for sure. You can also use Lakelyn, ammonium lactate cream. That's sort of what I've seen recommended, but to be honest, I'm underwhelmed with the success of it. I much prefer moisturizing with a urea based, and then just judicious filing is wonderful.
Gosh, I'm going to go home and now reevaluate my foot care regimen. Yes, I'm going to go rethink this whole thing. I just foot care, again, it's just something that you don't always think of, but it can really just help prevent so many issues. So this has been so helpful. And hopefully caregivers are listening and feeling a little more empowered or confident. As we wrap up, Sheila, are there any kind of success stories that you can think of over your career? You probably have hundreds of them, but is there one or two that maybe sticks out that can kind of help paint this whole picture together for caregivers that are listening?
My favorite story, I will tell you with permission, this woman is probably the reason why I struck out on my own to make an accessible foot care clinic. This lady was fantastic. I think she was about 85, living independently in her own home. Kids nearby would check on her, do her shopping, etc. But she was home, and she had that painful callus right on the 5th digit at the base there, and it was hurting her so much she couldn't walk straight. And her daughter, "Mom, you got to go to the podiatrist, get that taken off. Mom, go to the doctor." She thought it was so stupid to go to the doctor over something like a callus. Until she fell. She just lost her balance and fell, broke 3 ribs, ended up in the hospital for pain control, dismissed to a nursing home for rehab. And it took weeks. I still remain amazed that she got to go back home. I thought she'd be in a facility after that, but she did get to go back home. Very strong-willed lady. She had enough chutzpah for everybody. And after going through all of that, it was about 2.5 months before she finally was in, and I got to see her for her first visit. Took me about 15 minutes is all it took to take that thing out. And I kid you not, she got out of that podiatry chair. She looked down at her feet and she looked over at me and she said, "You're kidding." She just went through 2.5 months and so much pain, which what could have taken 15 minutes. And that is our world. It is, but we just can't get down there. Our eyes are at the wrong side of our feet. And there's different calluses. Some is thick skin callus that you can file off, but some are porokeratosis, where it grows just like a carrot straight into your foot. And it feels like you're walking on a rock. You can't walk on that. Nobody can. The 20-year-old can't. So I've also had, I have a gentleman where the plantar warts, he's just lived with them for decades. They cover probably a good 25% of his feet in different clusters now. And he also had neuropathy. So that was actually a blessing because the pain was already bad enough. And I do Swift microwave therapy. So we're all used to getting warts frozen. But it turns out that there is a microwave therapy that not only will treat the wart tissue, but it will also it mobilizes the immune system to go after the HPV virus that causes it. So this man is, after being told for decades there's nothing we can do for him to be able to walk pain-free is life-changing. So the bottom line is there's always getting to be more treatments. Insurance coverage has been a massive barrier in the podiatry world in the United States. And so I tend to watch both American and European stuff. A lot of what I do, Swift was developed in the UK 2011. Onifix was developed in Denmark, non-surgical treatment for ingrown toenails, not covered by insurance, but my gosh, it's a similar resin as what's used for cavities for fillings, and it keeps them from having to go in for surgery and do foot soaks for a month. These are big advantages when mobility and dignity are at stake. So anyway, lots of options. Don't give up, caregivers. It's the biggest job you got, and I'm back behind you absolutely, positively, 100% all the way.
Thank you so much for sharing those examples, Sheila. And I think you said something really key that I want to reiterate. That one woman said, "Well, I think it's silly to go to the doctor for this little issue." And as you pointed out, that could have saved her so much.
My gosh.
Probably heartache, physical pain, emotional pain. And so when it comes to our feet, what I'm taking away is no problem is too little of a problem to go in, have assessed. And there's so many things that you can do to make your feet more comfortable and healthier. And a lot of them are just these little things that you can introduce each and every day, kind of in the caregiving routine.
Absolutely. Absolutely.
Well, Sheila, thank you. Oh, go ahead. I'll let you.
I was going to ask you, Lakelyn, I have a handout I give to all of my new patients just with quick 2 and 3 sentences for each category, just basic information. It isn't meant for specific guidance. It's just general foot care recommendations. It's a paper document, but if I forward that to you by email, is that helpful?
Yes, absolutely. We can find a way to
resource. It's not, it's not propriety. It's common sense is what it is, but it's all in one document. So,
well, gosh, that sounds like the most wonderful resource for our listeners. So we will certainly find a way to get that linked in the show notes or shared out. And Sheila, thank you for your generous offer to share that piece of as a resource and for your wisdom. Are there any other resources that I know you've mentioned so many already, but any others that you haven't touched on that you would want to share before we start wrapping up for today?
I just encourage, thankfully the internet is a really good resource for digging, and just keep going for the caregivers. When you have a problem, don't give up. Just keep digging. Talk to the primary doctor, talk to the staff, the home care people. They've seen nothing you're going to say is something they haven't seen before. This is so common and literally affects all of us as we get older. So that's a huge resource. The CDC even has a printout for diabetic foot care. I almost cringe a little when I hear about diabetes in your feet. They get the press because they get the amputations. Anybody with vascular disease gets amputations if not taken care of. So, but all that information applies to everybody, whether they have diabetes or not. So those are great resources to look into. I personally haven't found a one-stop shop for foot care. That's my website, footcaremn.com, has blurbs, but I am very busy in clinic and I don't get to put in my presentations. That is a resource I will be working on as much as possible. There is a lot of stuff I find online is geared toward the healthy foot. The feet who are not elderly, they're not arthritic, and these are very mobile people. So you'll get into the barefoot stuff and you'll get into we'll do this exercise and this exercise. I will say I'm a big fan of the toe presses where you press the big toes in and then the little toes in with the foot on the floor. Your toes are your balance, your toe strength. And so just doing your toe presses and then toe curls, and then of course toes to the nose. Very easy. This is not rocket science, people. You can do this. So it's cheap, easy, and it is fall prevention. So keep with that, and just don't take no for an answer when you see a problem.
Sheila, what great advice to wrap our conversation up with. And you provided so many great steps forward. Gosh, I could have used so many puns, but I resisted the urge. Right, I resisted. Right. But really, truly, so many great tips to help family caregivers and older adults navigate their foot care. And I'm just so grateful, Sheila, that you found your way to this calling in your career as a nurse. And thank you for all you're doing. And as we mentioned, we'll link to your website and all the other resources you provided in our show notes today. Thank you, Sheila, for being here.
My pleasure. Thank you, Lakelyn.
A big thank you to Sheila Buehler for joining us today and sharing such practical and thoughtful advice. I hope this conversation helps you feel more confident about supporting a loved one's foot health, because even the smallest steps can make a big difference in comfort, safety, and independence. If you enjoyed this episode, please subscribe, leave a review, and share it with another caregiver who might find it helpful. For more resources and updates, follow us on social media at Home Instead Inc. And as always, remember to take good care of yourself while you care for others. Caregiver Chats is brought to you by Home Instead. If you're looking for in-home care to support you on your caregiving journey, please visit homeinstead.com to learn more.